Charlie, the floor is yours.
Good to turn my microphone on. That would help. Thank you. It's a pleasure to share ideas with you all. And if you'll give me a moment, I will. Can you see that slide all right?
Yes.
Good. Thank you. Appreciate the feedback. Okay. As I was introduced, I'm Charlie Nahabedian, CEO of VideoKall. I founded it 20 years. I founded it after 20 years working in Bell Labs and AT&T, where I constantly introduced new technology, starting with wireless, then into microprocessor use, and my final project at AT&T was when Disney was opening the Epcot theme park in Disney World in Florida in 1982. My team was instrumental in implementing the networked 40 touchscreen guest kiosks, a brand new technology at the time, which completely revolutionized how users were guided through a theme park. I'm also an experienced entrepreneur. My first startup was sold to LG, which is what catapulted them into the cell phone business, because before they bought my company, they didn't know how to design cell phones. So today, I run a digital healthcare company. And you might ask, why the transition from telecommunications to healthcare? Well, when I was growing up with my 8 siblings in a small town in the US, my dad had to close his store and risk our family income anytime one of us got sick, so he could drive us to the doctor in the next town. And it took 3 of those trips to save my life from appendicitis at 18 months old. I will tell you, access to healthcare I view as most important to everyone. Remarkably, many people still experience the same challenges my family faced years ago. So I'm leveraging my deep experience in technology and telecom to propel digital healthcare. My mission is to help provide simple and early access to quality healthcare so that families don't have to experience similar hardships that I faced growing up. There are many combinations and permutations of functionality in this telemedicine space, many centered on particular diseases, special life situations, or available popular technology. On the patient end, telephones, smartphones, PCs, simple kiosks at stores, all with limited remote measurements to an attending doctor. The doctor does not get a direct reading, lowering confidence in an exact diagnosis. In the telecom segment, there is heavy reliance on the internet, cellular and Bluetooth, while accepting the limitations of each. These include slowdowns due to local congestion, dropped calls, especially for broader bandwidth video, which is desired by nurse practitioners. Medical servers also are mostly in the cloud, with specialized functions for their applications. And while the cloud is convenient, there can be added burdens for HIPAA and bandwidth. Many applications update their own platform records, but not the area's provider's medical records or wider health information exchanges. Unless you go to the doctor's office, urgent care, walk-in clinic, or emergency room, or pay for an Uber doc, these are your choices. Current competitors offer kiosks, video-only visits, or mini clinics. No one compares to the model we are offering today. Kiosks provide a limited diagnostic set of readings, primarily to the patient, for them to adjudicate. Video-only telehealth has limited diagnostics and/or patient-provided data. It's great for screening, but not for an accurate diagnosis and targeted prescriptions. In-office clinics provide a good physical exam, but probably not an EKG, and the patient records may or may not be updated. Of the three, this is the costliest alternative because of a dedicated person there, patient or not. In spite of these current solutions, healthcare problems are still multifold. 81% of patients in the US are unsatisfied with their healthcare experiences, as it can take days before getting your appointment and hours to meet with a physician. In the US, there are only 2,400 mini clinics out of over 88,000 drugstores in the US, meaning that a significant part of the population is underserved or unserved. Access is the most significant problem for patients. COVID-19 led to a boom in telehealth, but providers must rely on self-reported information. As I said earlier, this makes it challenging to provide an accurate diagnosis. Revenues, expenses, and quality are the provider problems. The effects of this past year have been both material and negative on hospitals in the US. COVID was often an accelerator, not the cause, of declining metrics for hospitals in the US. Hospitals are asking, how can our organization continue to care for our communities? The American Hospital Association reports that just 1/3 of US hospitals remain standalone or independent. For those based in rural areas, 1 in 4 are at a high risk of closure. To take a fresh look at what is possible, I recruited a talented team that has successfully exited over 10 startups. Vince is an expert in satellite and fiber. Dave is an expert in systems and circuit design and development. Niraj is an expert in software architecture and design and management. We have medical and healthcare specialists to support our wellness initiatives. This shows a few of them. Nancy is a general practitioner who rose to senior vice president at Mass General Hospital and was chief medical officer for CVS Mini Clinics for 6 years. Mark has been a CMO for 2 health systems. Doctors Ben Berg and Neil Sicker are telehealth experts in research and teaching universities. So I go back to this wide expanse. For our solutions, we're maximizing patient instrumentation, interfacing with all telecom and computer connectivity. We're guiding patients, eliminating an attendant physically with a patient during the exam. Considering all the telecom alternatives, each installation is optimized for the local constraints. We prefer a committed information rate where there are no drop calls and no degradation. We are including as many medical applications as possible in servers to maximize the benefit to patients and providers. We strategically place these servers to maximize HIPAA and bandwidth concerns and use cloud services where most appropriate. This architecture allows us to add applications that others develop to enhance the value of the platform and bring more healthcare services to the population. Finally, we're aiming to bring interoperability to levels not previously considered in electronic health record systems and health information exchanges. Our platform is unique and enables the world's first comprehensive, remotely controlled physical exam, and this is only the beginning. We are seeking locations where the need is greatest. First, we've identified remote locations where folks drive 2 to 6 hours to get medical attention. Generally, that population is older, with more chronic illnesses, and with lower household incomes. Second, in the senior living communities, many folks do not drive, and they need to coordinate personal, medical, and driver schedules just to get to their latest symptoms checked. Or they can call an Uber doc or 911 emergency services. This population also tends to have a higher frequency of doctor visits than adults under 55. Retail man clinics are slowly increasing, but they are more expensive to operate and have less than a 10% penetration at best in the US. Corporations are trying to reduce costs and employee downtime by installing manned clinics at large facilities like their headquarters, clearly uneconomical for their small and medium-sized locations. We're focusing on individual features and functions that quickly drive patient acceptance and easy adaptability, using proven and latest technologies to achieve the drivers of acceptance. These are the types of considerations that made the iPhone popular so quickly, and ATMs are as popular as they are today. Until the introduction of the iPhone, many people had a separate cell phone and a personal digital assistant. When companies combined these two, Apple added cameras and many supplemental communications and games, everything in one convenient device. That is where we're heading in healthcare with telehealth. So, what is the right combination of proven and latest technologies to achieve the drivers of acceptance? How do each of these contribute in a small or major way to optimizing the various aspects of the architecture? Key to reducing cost of service and increasing user satisfaction are broadband video and complete sanitization. Done correctly, these satisfy provider and patient requirements. Key to lower initial costs and maintaining reliability are the use of intelligent telecom and system management. This is a direct carryover and extension of proven telecom technologies and techniques. Key to higher availability are system monitoring. This proves tantamount to customer revisits, provider revenue, and ROI. So what's our solution? It's a patented smart chair or clinic that's equipped with telecom technology to provide a clear TV quality visit with a medical provider that's remotely located, guiding the patient in the use of telediagnostic instruments that are all remotely controlled from a safe and virtual distance. The instruments and all are enabled by a secure private medical portal. The smart clinic or chair is served by a virtual physician and nurse practitioner who remotely controls and directly monitors diagnostic instruments. Find one of our locations, preload the data in our mobile app for all visits, sit in the chair, and immediately connect to a provider for a virtual physical exam. The patient has no physical assistant at the clinic, and the patient has no physical assistant during the exam in the chair. We have created and patented instruments and subsystems to meet our objectives for easy patient use. The provider remotely controls and records up to 11 vital signs just as if you were sitting beside them. They have a high confidence factor in these readings because they're reading them directly. There's no interpretation by the patient. Most folks don't have more than half of these at home. In almost all cases, the readings are observed by the patient, not the medical personnel. Your targeted prescriptions can be sent electronically to your pharmacy. Your patient records are updated. On exit, the entire cabin self-sanitizes, leaving a pristine environment for the next patient. We have 11 instruments, as you can see listed there, both for seasonal illnesses of all kinds and for certain chronic illnesses. And you can see we've got a potential list of 17 other instruments and applications in line to be added to the platform as they're approved by the federal, the FDA here. To make this meet provider and patient requirements, we have almost as much technology as a smartphone. We have a robust broadband platform, subsystems for patient use and cleanliness, working over any fiber or wireless facilities, including satellite. A key aspect are the patented subsystems to eliminate needing a person to assist a fully ambulatory patient. Have you ever had a doctor listen to your lungs? It's most important for COVID screening and other pulmonary issues. In our system, the patient just leans back in their seat and the doc does the rest. Do you have a kiosk that does not sanitize or partially sanitizes with a single technology? One thing I learned at Disney World, the public does not have clean hands all the time. We use more than 2 technologies plus a patent-pending instrument cleaning system to assure cleanliness and sanitation in the cabin unit. And the last mile is still challenging today in underserved and unserved markets. That is why we use the best telecom choice for each installation. Our knowledge of telecom is deep. Broadband satellite channels normally work full-time, but ours work only when there's a patient needing service. This lowers costs of operation, accommodates more patient units, and allows us to support mobile units and fully manage technical issues on the entire platform. Our business model is simple. Support the providers by providing a brand new, profitable revenue stream. We recoup our costs by collecting a small fee from the providers for each patient visit. Our patient units can be purchased, leased, or loaned with bundle maintenance, and there's flexibility in our model for concessions, franchises, licensing, and dedicated low-volume locations. Together, we provide patients easy and safe access to healthcare and enable medical providers to connect with patients in new ways and in new places. Our solution will facilitate competition amongst providers and user locations. We're seeking partners. We want to see our solutions implemented around the globe. Initially, we are targeting senior and remote communities. These are markets where the need is greatest. Patient needs include seasonal and chronic illnesses, as well as behavioral counseling, telepsychology, and telepsychiatry. One of our providers has signed up, already promises to provide all of those. There is nothing more convenient than walking down the hall or the next building, or when shopping for groceries or drugstore items, to get checked out and immediately set on the right regimen for improved health. We're just getting started and are poised to make a huge impact on healthcare. I invite you to connect, and I thank you for your time and interest.